What's up guys, welcome back to my YouTube channel. It's your boy Vimal Thomas. And guys, thank you for helping me and supporting me in my first video. And today we will be studying about diaphragm. Guys, what is diaphragm? Diaphragm is a fibromuscular septum that separates the abdominal cavity and the thoracic cavity. It's a fibromuscular septum that separates the thorax and the abdomen. So the important things in the diaphragm are, first thing you have to remember is that, first one, it is a primary muscle for respiration. Primary muscle for respiration. And the second thing is that it is dome shaped. This diaphragm is divided into two parts. There is a muscular part and there is a peripheral part. The origin of the diaphragm can be divided into three parts. There is a sternal part, there is a costal part, there is a vertebral part. Origin of diaphragm. Can be divided into three parts. The first part is the sternal part. The second part is the costal part. And the third part is the vertebral part. As the name suggests, sternal part, it arises from the base of the xiphoid process or the posterior side of the xiphoid process. So if you're considering, let this be the sternum, this is the manubrium, body and the xiphoid process. So, and let this be the ribs. So the sternal part arises from the posterior part of the xiphoid process. Now as the name suggests, costal part. So this is posterior part of xiphoid process. Next thing, the costal part. So as the name suggests, costal part, it arises from the costal cartilage. So the sixth rib and costal cartilage. And next one is the vertebral part. The vertebral part arises from the crura and the arcuate ligaments. From the crura and the arcuate ligaments. The next most important parts in the diaphragm are the openings of the diaphragm. There are mainly three major openings in the diaphragm. There are three openings: aortal opening, esophageal opening and caval opening. So, aortal opening, the first one, it lies at the level of 12th thoracic vertebra. So, it lies at the level of 12th thoracic vertebra. And the second thing, that it transmits thoracic duct and aorta. It transmits thoracic duct and aorta. The next one is the esophageal opening. The esophageal opening is at the located at the level of 10th thoracic vertebra. So it is located at the level of 10th thoracic vertebra. And what do it transmit? It transmits the esophagus and the right and the left vagus. Transmits esophagus and right and left vagus. Last one is the caval opening. So the caval opening lies at the level of 8th thoracic vertebra. Lies at the level of 8th thoracic vertebra. And what do it transmit? It transmits the right phrenic nerve, the right phrenic nerve and the inferior vena cava. The important things are the right dome of the diaphragm and the left dome of the diaphragm. So the right dome of the diaphragm reaches up to the level of 4th thoracic vertebra, and the left dome of the diaphragm reaches up to 5th thoracic vertebra. Next we will be studying about the surfaces of the diaphragm. There are two surfaces of the diaphragm. First one is the superior surface, and then we have the inferior surface. The superior surface is covered by endothoracic fascia, parietal pleura, and by fibrous pericardium, which is directly attached to the central tendon. So we have first one, endothoracic fascia. Then we have parietal pleura. Fibrous pericardium. Which is then attached to the center. So next we have the inferior surface. The inferior surface is covered by endo-abdominal fascia and parietal peritoneum. It's covered by endo-abdominal fascia and parietal peritoneum. Next we will be studying about the weak places in diaphragm. So diaphragm has little weak spaces where the muscular fibers are absent. And these weak spaces are the places in which the pus can be spread. So the weak places of diaphragm are three. The first one is the slit of Leydig, which is located between the sternal part and the costal part on the left. And second, we have the slit of Morgagni, which is located between the sternal part and the costal part of the diaphragm on the right. And thirdly, we have the slit of Bohdalak, which is located between costal part and vertebral part on both sides. These weak places of diaphragm, they are hernia prone areas. The hernia can occur in middle-aged man with weak musculature, etc. Next we will be studying about the nerve supply of the diaphragm. So the nerve supply to this diaphragm is by phrenic nerve. Another important thing that we should remember about diaphragm is that the phrenic nerve in the neck, if we compress that, or the dome of the diaphragm can be paralyzed by crushing the phrenic nerve in the neck, which is also used in the treatments of lung tuberculosis, etc. And that's all, guys. Thank you all.